Hello everybody and welcome to Jeff the Pharmacist. So today I want to talk about a new drug for migraines, and that is Emgality. So Emgality is a once monthly self-administered injection. The first month would be like a double dose. It's called a loading dose, and followed by that it would be once a month at 120 milligrams. So that first dose is 240 milligrams, and then the next month would be 120 milligrams. And they come in these self-administered pens. And I can link on my website the savings program as well as the video describing how to use the pen if you have it and you forgot what the doctor told you, or maybe they didn't tell you. But I'll link to that. So I like to start the video with the mechanism of action. So the drug works by attacking something called CGRP, which is calcitonin gene-related peptide, basically bonding to this protein and making it too big to go into its receptor. And what that does is it stops a cascade of events on the molecular level that would lead to signaling to create some probably inflammation in the meninges that would lead to a migraine headache. So, I mean, it's not that important that you know that, just that it's working on a molecular level. It's a monoclonal antibody, which is different than traditional drugs. That's why it's got to be kind of injected. It can't really go through the stomach like a pill can. And it looks to be pretty promising for patients. It looks like patients that have episodic migraines, which is less severe, actually responded better. So episodic is 0 to 14 headaches a month, and chronic is greater than 15. And they measured they measured headache days, which are days where people had migraine headaches, and basically they saw a reduction, and I'll share the chart with you. So the first thing I want to go over, this is episodic migraines. So like I said before, patients in the study, they were defined as patients with 4 to 14 migraine headaches a month. And the baseline, which is the average, was 9.2 days with migraine headaches. And the reduction was about 50%, or 4.7 headache days. And in the next study, it was 4.3. It was about a 50% reduction on average. Now, different people responded differently, and there was most people had at least a 50% reduction, but not all. So there was, 40% who fared less than that. 39% of patients had a greater than 75% response, and there were even some people who had 100% reduction in migraine headaches. So if we move on to the chronic sufferers, these are people with greater than 15 headaches a month, headache days per month. So it's almost 20 days that they're suffering. The mean change was about the same, about 4.8. So if I would simplify it, I would just say that the drug on average reduces the number of days you're going to suffer by about 4 to 5 days, with some people being less and some people being more. So, but it is on average 4 to 5 days. And I think it helps to think of it in those terms. You might be better off or worse off, but it looks to be an effective product. And the adverse reactions, I mean, when you think of these injectable products, I think of stuff for like plaque psoriasis that has cancer risks and depression risks and everything else. This product actually is pretty well tolerated, very well actually. The most common side effect, most notable side effect really is an injection site reaction. And that's typical with all injections basically. Anaphylactic reactions are possible with any drug. And those run the gamut from hives, skin rash, throat swelling, and tongue swelling in severe, more rare cases, but it's still a severe reaction. And you know, when we talk about saying somebody has a severe peanut allergy or an allergy to sesame seeds or something, it's that type of thing where if they had a peanut butter and jelly sandwich, they would really have to be rushed to the hospital. That's the kind of thing that can occur with drugs. And then one kind of weird thing that happens with protein-based drugs is something called immunogenicity. And what that is, that's when your body attacks the drug and destroys it without you really knowing about it. You don't have hives, you don't have swelling or anything like that. Your body just attacks the drug and eliminates it, and so you're not really getting that full complete dose, but you might not really know it. And they studied this through the duration of the study, which was a year, and about 12% of people after a year had some antibodies to the drug, so some immunity had developed to this product and actually was probably destroying some of that dose. I don't know if it's all of it, but it would be not, it would definitely be some of it would be taken out by the body's immune system. But other than that, and that's pretty typical with other drugs like insulin or some of these injectable products for diabetes, the body tends to do that with proteins, just tends to kind of destroy them. But other than that, probably the basic downside is that it's an injection, but it's only once a month, so that's not so bad. And it's other than that, it's fairly well tolerated as far as drugs go, especially injectable drugs. So I hope you guys found this interesting. If you did, please give me a thumbs up. If you have a story about this drug or about migraines, let me know. I'd be interested to hear about it. Or if you have any suggestions for a video or questions. I hope you guys found this interesting. If you did, please give me a thumbs up and please subscribe. It would be a great honor. I want to thank you guys for watching. Thanks a lot.